you talked about, I remember from previous with your COVID vaccine, you had experienced some acute pain that
Or
then turned to chronic pain.
yes, right. So when and this is how I get involved with the super patch people. But I had my mandated by the federal government assault, right? And they forced me to take a vaccine, which I mean I didn't want to do it because I had just had COVID, and to me it made no sense. This was
Right.
an illogic request, in my opinion.
You couldn't go to work in the hospital.
Yeah, didn't go to work. I had no choice, and I thought, well,
We had no choice. We had no
yeah,
idea whether
it,
you want to
I
walk through the jars, you better have a piece of paper that says
yeah, exactly. And I've taken every other stupid ass vaccine they've ever asked me to take, which is fine. I'm in the healthcare world. I'm exposed to disease. I get it. So take my vaccine. Within a week to 10 days, I had one of these very bizarre, I did not pass out, but for the world, you would have thought I would have because I just collapsed like a deck of cards. I was crossing the street with my husband and that my body just stopped working and I just fell right on the sidewalk, from right on the middle of the cement. Someone almost hit me with the car, broke
sack of
my.
potatoes. They threw a sack of potatoes out the window and boom.
Yep, broke my nose. My husband makes it to the other side of the street and is wondering where the hell I am, and he sees me in the street, not moving. He freaked out, like, what the hell just happened? And then I kind of look at him like that was the weirdest thing. And I'm having, and my nose is bleeding, my eye, I'm straightening out my nose. It was the strangest thing. And from there, I don't know what happened. Like that, I have no clue what kind of weird brain body dissociation just occurred. And gradually, over the course of the next 2 months, I developed swelling in all of my joints. And to the point where it was very hard to operate. And yeah, they put me on steroids and all kinds of stuff. And so this acute pain that I was undergoing became a chronic thing. Like I couldn't move.
Right.
I almost lost my profession as a result, which is sort of how I started talking online, and that's where I met Mark McDonald. And if I know the people watching probably don't know who he is, or if they do, and he's a nutritionist who was about to start an online TV show, and he thought, oh, I need a doctor to talk. Dr. Anna, you're perfect. I was like, okay, whatever. And so I was on his online TV show on Brinks TV, and he got a brand new sponsor, Jay Dollywall and Super Patch. So I'm sitting kind of like off camera on the Zoom meetings were like this. And Jay starts talking about the technology. He's talking, I'm looking up superpatch.com. I bought like 5 different types before I even got to say a word to him because I was so fascinated because he talked about pain. It was all about pain, no medicine, which is important to me. I'm a doctor. Oh, and there's one for sleep and I can't sleep, and there's one for stress, and I think stress is a big part of my life, et cetera, et cetera. And it's like I bought all these things,
Right.
but it was really a miracle because within 2 or 3 days, like I was actually able to go from sitting to standing. I was able to walk upstairs with minimal assistance. And that I hadn't been able to do for a year and a half prior to me meeting him and getting one of these back. Like that solved me. Like that, it made a huge 180. Now I can work out. Now I still have a long way to go, and I still get swelling, and my wrist is still not completely articulating. And when I'm having a bad day, it still turns red. But it's much better. And Super Patch is a very big part of that, which is why I agreed to be on his medical board because I'm like, man, the world needs to know about the technology. But yet at the same time, I have like you did throw one on somebody in acute pain, and it works.
Yeah.
And my patients after surgery, I suggest wear one of these patches, change it every 24 hours. It will help. I don't write for narcotics in my practice.
What do you see just anecdotally, right? I mean, just, you know, like patient pain relief. I mean, you've been doing this a long time, so
Yes.
you know,
Yes.
um, especially people have multiple operations or these
Yes.
levels of pain that they experience, and how is just applying that as part of your regimen, how has that helped your patients?
It well, I don't write for narcotics anymore. Um, and the way we apply that pain patch is put it closest to the worst part of the pain that you can feel. So for me, every part of me hurt, but my right knee was the worst. And so I applied it to my right knee.
Now, just
First,
or like psychosis, like that.
I
Come on, like if we look at the data and we look at the channels being omnipresent, it's
yes.
not makes you feel better.
Yeah, it's for whatever reason, and maybe I could have. This was my experience. Okay, on the pain patch, I'm gonna tell you what my experience is right here.
Yeah.
Okay,
All right.
I put it on the site of the pain. What I thought was the site of the pain. What I recognized was within 20 or 30 minutes, the spot where I put it didn't hurt, but it was hurting just like below where I put the little band-aid into the right. Okay. So the next day, when it's time to put another one on, I put it on just below and to the right. And I chased around that hot spot for maybe 3 days. By day number 4, that no longer hurt. Okay. Like there was no pain in that knee, period. And within a week, now I no longer have the pain in my wrists, in my shoulder, in my hips, and whatnot. So for me to get rid of all of my joint pain truly was a 1 to 2 week period of time. But the acute pain in the right knee that would buckle and I almost fell multiple times because the pain, like you just buckle to the ground and fall, that went away instantly when I put the thing right there, if that makes sense. And the study at the University of Miami is that after 2 weeks of applying a patch, and they just put it anywhere, they didn't put it on the pain. Those patients used 80% less pain medicine. So in my practice for surgery, I will tell those patients to start wearing their little pain patch a couple of days before the operation.
Yep.
And then that way, that phenomenon of, like you got to wear it for several days before everything cools down. I want to have that preemptively in the system. Most of my patients, the way I do surgery robotically, the right lower quadrant incision is almost always the most painful. It's the one that's my robot staple port. It's a little bit bigger.
Yep.
And so I will tell them post-op, put that little patch just above that port site because that tends to be where people
That's
have the
fine.
most pain. Yeah, and there are patients who will take 0 medicines after these surgeries if they do that advice. In the hospital, obviously the patient has access to all kinds of medicine, but they may not take any of it. It's fascinating.
Right? Just push the button.
Yeah, no, well, yeah, that I don't even write that anymore. They don't need it. It's fascinating.
Very.
It's going to change the way we do surgery. I'm 100% convinced of that. And the patient's recovery is so much different and so much more pleasurable for them, and so like they're shocked that they just had surgery. Many of them
Yeah.
are just so surprised. So when done right, proper nutrition in these little patches, I'm telling you, have changed the way I practice medicine. So
Well, I'm excited to get it into more surgeons' hands,
yes, for sure.
because they've been operating for a long time, right?
Yeah.
Ty Erickson,
Yep.
Dr. Veronicus,
Yeah.
they know what.
Yeah. Oh, and if they're doing the enhanced recovery after surgery type protocols, then they're going to eat this up because the whole point of that protocol is how little mind altering drugs can you give someone because their outcomes will be better. Narcotics are inflammatory and they prolong the healing process. People who take narcotics hurt longer and need the medicine longer than people who don't take any at all. So the difference in my outcomes compared to most surgeons is going to be diet, And these patches is part of my post-op recovery. That's the difference.
So you always say, hey, Zyve 7, Freedom Patch.
Yeah,
Anything
100%.
else that you think about here? Because like someone like Dr. Veronicus, he's got, patients that travel all over the world.
Yeah.
So would it be the Peace Patch, the REM, help?
I have my patients do Freedom for Pain, a Liberty patch for basically vagal nerve support,
Okay.
a Peace patch for stress. And those three are kind of my mandatory. If you struggle with sleep, yes, you can add a REM. And if you're traveling all over creation, if you're worried about blood clots and that sort of thing, you can always do a Defend patch.
Well, depends, but then I know Victory. I recommended that to my dad from a circulation standpoint.
Yeah.
It's supposed to up.
Yeah, yes, the Victory is good for mobility. It doesn't quite hit all of the vagal. It's not quite as broad spectrum as the Liberty in
Okay.
the vagal nerve sort of setup. But
Let's unpack that for a second because it's people think of it from uh, a mobility standpoint
yes.
and balance standpoint, but also what other receptors is it targeting?
Yeah, and it appears that based on the EEG studies that Jay has done, and then I've seen the way he maps the EEGs. When a Liberty patch is applied, you can see the posterior aspect of the spinal cord, what we call the dorsal column medial lemniscus, lights up back to normal, like to a homeostasis.
Goes green.
Straight, the posterior straight to the cerebellum. These are the balance centers of your body. The posterior column and the cerebellum are what give you proprioception. When they do Victory patch, yes, you get some of that, plus it gets some of the other more like recovery, torque, force, those kinds of things. So it's more expansive. So it gets a little less of like the central part of the brain stem where the vagal nerve comes off.
Yep.
So the Liberty patch is going to hit where the vagal nerve comes off. So it really does help hit overall homeostasis. And as a general rule, in Jay's opinion, everyone should be wearing a Liberty patch as a baseline and then add to it your freedom or your stress or whatever. And if you have a medical issue that you're trying to correct, if you're an athlete, okay, you don't need the vagal nerve stuff as much, right? You're looking for athletic performance,
Right.
and then that Victory can be a standalone, if that makes sense.
Yep. No, it does. It does. So for someone who's 80, in shape, but certainly not,
Yes.
he's going on walks.
Yep. Yeah.
And
Yeah.
that would be his athletic,
Yeah. And
then you'd say, hey, Liberty.
Liberty patch for dad,
It's
because
more.
That'll also help him basically with blood pressure issues and whatnot. Now, that's not a claim that I'm making. I'm just saying it gives you more of a vagal nerve or central nervous system homeostasis. So it'll help him with more than just sort of balance in that regard. But we say if you're going for a walk so you don't fall, Liberty patch, the claim we're making is balance. That's what was tested.
Right.
There are some people who really, really struggle to move altogether. It is an athletic endeavor just for them to get up and walk across the room. And they may actually find they do better with a Victory patch because of it. You know what I'm saying?
Yeah.
So you do need to kind of think of those two things in that way. But like my mom, who does a lot of walking, she's a Liberty patch person, So,
All right. No, that's great information. I think every time we chat, we unpack things that we know will be helpful for the
yeah,
people
yeah, yeah.
follow us. And we're gonna create some little shorts. We'll get them posted to the Arms Medical Venu Health channel, and
Yes.
then we'll send some things out to you, Dr. Toker, at Dr. Anna on Instagram.
And Dr. Anna Toker.
Add the Toker.
You gotta add the toker. You gotta always add the toker.
Anna, is Dr. Anna take? Is that one available, Dr. Anna? It's so funny because
There is a Dr. Anna, and yes, it's taken.
okay,
There is a Dr. Anna.
well, there's only one Anna Toker though.
There's only one Anna Toker, so the Dr. Anna Toker is mine. So that's where you find me.
Let's see if Muriel has any questions. Muriel, she's in the studio. She's making sure that this is all done correctly.
Yes.
So, you get any questions for Dr. Anna Toker?
I excuse my appearance and the fact that I'm in my car. Okay. I was running errands. My day's been long. Got meals done.
I've had multiple calls in my car, and you know what? Sometimes you just got to show up, and your nails are done, and
Now I'm going to be in Greece for 2 weeks, and don't you be calling me.
I'm not calling you. We are. The show will go on next week.
Okay.
I'll see who we can get on here. Maybe I'm gonna try to get Terry on here. Terry can then talk about the business side of things. We can pause on the science side. I want someone to talk with me.
Tell him in exchange, I will talk. He does a really, really big Facebook group. Tell him to just have me onto his Facebook group, and he can pick my brain.
There you go.
Exchange services.
That's right. That's right. I already committed that.
You already pimped me out. Wow, I'll be darned.
I said we will. Right. I will tag team on that, and of course for his expertise because he's been so successful at this.
Yeah, for sure.
That we're like the new kids on the block.
Yes. Yeah, very new. Very, very new.
All right.
All right, dude, I'm gonna get going. My husband's wondering where the hell I am. So
Muriel's got one question.
Yes.
Can I wear multiple pain patch at once, or is it only one? Because I know if I tell my mom about this, she's gonna want to patch all over her body.
Right. So my mother does this too. Okay, here's the situation.
All right. So the question is the multiple pain patches, right?
You
One is good, two is better. It's got to be, right?
No. Right. The reality is this, because it's not pharmacy, there's no dose dependence. It either works or it does not work. And so you really should only need one. Now, I will be honest with you. My mother, I cannot convince her otherwise. She will wear more than one.
Of the same kind.
Of the same kind. So you can wear one of each of the different kinds at the same time. That is not an issue.
Right.
But like if you need pain, or you need it, and it's the pain that comes up. For acute pain, you might find it more effective and I don't know if it's psychosomatic or not. My mother swears she needs two. But I'm thinking, I know from my own experience, after a week, if it's chronic pain, all of my pain was improved with just one.
Right.
So, and I never tried more than one because
we haven't done the studies. We don't know if you get there faster and if it.
You don't know. You don't know.
Haptic signal, does it calm it down faster?
I don't know. I don't know. On the EEG studies, 1 lights up the spot that it's supposed to light up, and 2 doesn't light it up anymore. So in theory, that's
you got one pathway.
Yeah.
And you're duplicating it. If you feel like it's helping,
then you do you.
You do you.
Yes. It's not going to hurt anything. It is not going to hurt anything. If you think it's helping you, then please, by all means, do so.
Who's the soccer player that has tooth? Like each leg. It's like a USA soccer player with the USA women's team. I know she has one on each leg, a victory. I think just like I cannot be running around with just one on my left leg. I gotta have one on my left, one on my right. I put it
correct.
In the same spot.
It's like why you'll never see a baseball player actually step on the chalk lines. You know what I'm saying? Like their shoes have to be tied exactly the same way. I kind of get it. I was an athlete. I absolutely get it. But in theory, that is not required. If you feel like that psychologically you got to have it, then you just go for it. You're not going to do anything.
Or $1.60 more. That's basically they're going, hey, all right, I'm at $1.60, but I feel better.
If you got to take a pill every 4 hours for your pain, you're racking up probably, if it's a prescription medicine, you're racking up $5, $10, $20. $2.50 doesn't sound like a big, contribution, right? Like where to? What the hell?
Yeah.
A $3.
The other, I think you've got something coming up. Did you do anything with your little energy drink yet? How are you doing? How are you personally doing on your energy drink? Let's talk about that for
5-hour energies. I started drinking 5-hour energies 20 years ago, right after I had my son. And I had it every single day of my life. Like when we travel on vacation, I pack enough to last for vacation. Like this is how important it is to me.
14 now. There you go.
For 20 years. That's what I've done. Exactly. And here it is. I'm older. And they put me on steroids and I'm off that and I'm starting to work out again and I'm getting back in shape. But I'm gaining muscle and I'm feeling better, but I can't lose the fat. So I double back down like my clean diet and all that kind of stuff. And I'm thinking, honestly, I should be able to lose this little bit of fat. Is it a hormone? Do I have a liver problem? And then I thought, I'm not eating as clean as I should be. 5-hour energy. I have an app called the Yucca app right on my phone. And it just reads the barcode and spits up all that. And I have not done that yet to this. I bought this in a gas station yesterday. It just happens because I had to drive to Lubbock and back. That's why it's in my car. And I just, out of instinct, just drank some. Anyway, so Yucca app, oh my God, the toxins that are in that 5-hour energy. And I decided to stop it. And right about then, I ordered some boost patches. And frankly, I don't even do caffeine in the morning. I mean, yesterday was the Wednesday and Thursday because I had to make a dash run from Dallas to Lubbock to see my son who was sick. It was the first time in 3 weeks I'd had any caffeine. So really, it's helped me enormously. I feel great. Have I lost weight? No, but I feel great. So, and I'm not addicted to that stuff anymore. So I feel like that's a victory.
So what did Jay I always think of formulary standpoint, right? Formulary EEG, right? That's like,
yes,
EEG.
His formulary is the EEG. Yep.
Right, but that's how I think about it. What was his? What receptors is he triggering on? Is he?
So here's the problem, and because he keeps a lot of that very, 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 very tight to the vest. I don't know exactly which, and I haven't seen a 3D EEG. Like he does these color-coded. He wrote a computer program that can interpret a full EEG and turn it into a 360-degree color-coded brain.
Yep.
Like he mapped the brain with the EEGs. It's very cool. And that's how he can tell what pathway he's triggering, but he doesn't ever tell anybody exactly how much the pathway is getting covered. I'm guessing which pathways are getting covered by watching which symptom is improving.
Right.
Now, so you're certainly more alert. So my thoughts are, is there a little bit, and the focus thing makes you more alert, but they kind of feel a little bit different. So they must have a little bit of an overlap somewhere, some way. I have no proof of that. I have no way of knowing. Jay will never tell you. There's no way of knowing. You will never know. It's a secret, top secret. He will never tell you. But the shit works and it's amazing. That's all.
I think is something from a cardiovascular, even a GI standpoint, that it's hitting some different receptors that's giving you that elevation. That's
yeah, it's probably, I mean,
it's replacing that boost that you get from other products, right?
But it doesn't cause the shakiness and it doesn't cause any tachycardia or anything like this. There's no crash. There's no relative crash. The way caffeine works is by blocking adenosine in your body. And so this patch is not going to be blocking any adenosine. It's just simply lighting up the pathway that adenosine normally would make you more sleepy. So I don't know. I don't know. Maybe on his deathbed he will say something. I don't know.
We can tweak out. We can find maybe pull out a little bit of info from them on just the
What I need to
and that
do,
it probably has a little bit of that crossover from the focus to the
yes,
um
it probably gets it probably has a little bit of the focus crossover, and it might even have some vagal nerve crossover, like the Liberty, maybe a little bit.
yeah.
I bet you there's a little crossover between those two. But anyway,
I just always picture him just with a dial, a little bit up, tail down.
I don't even know how he figured it out. And he says it himself. It was divinely inspired. God gave him this like idea of what that pattern would look like, and the hell it works. So, and now all he has to do is tweak with it a little bit to make sure just the right part of the brain lights up green, and he's got it.
Yeah.
It's very interesting. But
Okay.
all right, I'm gonna bolt.
Enjoy. Thanks.
All right, we'll see you guys in 2 weeks.
All right.